This conference will now be recorded.
Okay. Okay, so welcome everyone to the first PRECEDE monthly study coordinator call. We'll be having these on the third Tuesday and Wednesday of each month. You can attend either one. You do not have to attend both, but if you'd like to, you're more than welcome to. A couple of housekeeping items before we get started. This call is being recorded and the recording will be made available on the study website. If you are not speaking, we do ask that you please mute your phone. This will help with the background noise. And if you'd like to ask a question and you just don't feel comfortable speaking up, you can use the chat function and you can actually find that on the upper right-hand side of your screen. So today our agenda is going to be welcome and introductions, screening and enrollment, completing visits, biosample labels, PRECEDE link releases, coordinator newsletter, and finally some reminders. So the PRECEDE Consortium Principal Investigator is Diane Simeon from NYU. And then Jessica Everett is the Project Manager for PRECEDE at NYU. The Data Coordinating Center at Arbor Research includes John Graff, the Program Director, Melissa Fava, the Program Manager, Julia Nafschiff, the Project Associate, and then myself, Melissa Sexton, who is the Clinical Research Associate. So anytime that you send us an email, we want to make sure that you send it to Arbor Research, or I'm sorry, to PRECEDE DCC at Arbor Research. And that way we know that it'll go to multiple people and we'll make sure that it gets to the person who it needs to get to answer your questions. So screening and enrollment. When screening patients for eligibility in the PRECEDE, remember that patients to be enrolled in cohort 1 need to have a clinic visit with standard of care genetic testing and imaging put in place. This is a requirement to participate in the study. Okay. And then also as a reminder, while patients with tattoos are not able to get CT scans, they are able to get EUS.
It's actually MRI where there's difficulty with people with tattoos.
Oh, MRI.
Not CT scans.
Okay, thank you so much, John, for correcting me.
It's due to the heavy metals in the dyes of tattoos.
And John, is that true across the board or just for people who are rather heavily tattooed?
So, you know, there's a lot of literature on this, and some people, even who are heavily tattooed, still get MRIs. I hear it can be quite painful depending on the amount of heavy metals in the ink that was used. So, you know, that's a discussion that has to be had with the patient themselves.
Okay, thank you.
Yeah, usually it also has to do with the how old the tattoos are, because they aren't using the heavy metals in the inks as often now. But as John said, it's a case-by-case situation.
Okay, gotcha. Thank you.
Okay. Great, thank you for your input. That's very helpful. Okay, so if you have the ability to consent people at the time of their clinic visit, that should be a great way to capture folks already engaged or who are intending to engage in surveillance. If a participant wants to only give a one-time blood sample, but do not want to do anything else clinically, you can consider entering them in cohort 5. Their samples could still be potentially useful for gene hunting work, for example. So do you have any questions regarding screening or enrollment? I see we have a question. So from Ariel, if individuals have a clinic visit and don't speak with a genetic counselor or speak with a genetic counselor and choose not to proceed with genetic testing, are they still eligible for cohort 1?
So a lot of the eligibility criteria are based on genetic testing. So I'm going to throw this one to you, Shannon. My preference would be to say no. They are not eligible.
Can you repeat the question one more time just for clarity to make sure that I'm answering
It's
it
in
the
the
right way?
chat box.
Okay.
I can repeat it for you. If individuals have a clinic visit and don't speak with a genetic counselor or speak with a genetic counselor and choose not to proceed with genetic testing, are they still eligible for cohort 1?
Yeah. Although if you're from an FPC family and you haven't clarified whether or not the family history of pancreatic cancer is due to a genetic mutation or not, you're kind of in this limbo space. A scenario I can think of is that if someone comes to a clinic with a known mutation and a family history that makes them eligible for cohort 1, if all of the criteria are met and you just don't have a genetic counselor there, that's one thing. But I agree with John that most of the time you're going to want to know a person's genetic status either at the time they're coming there or through genetic testing ordered at the visit to truly sort them into cohort 1 and to make sure that they're in the right sort of cohort 1 bucket. Because some FPC is going to turn out to be due to a mutation.
So yeah, Guillermo, you asked, can they give prior genetic testing? Yes, they can give prior genetic testing
Yes.
results. And Ariel, to answer your original question, because we really didn't answer it definitively.
Yeah.
If someone did come in with FPC and a family history of pancreatic cancer, we still, the system will let them be enrolled into cohort 1, and they may be useful. They're of limited utility for future analyses. So while my preference would be not to enroll them, they probably just would be left out of future analyses, which
Yep.
is kind of a waste of everybody's time.
Okay. And then we have Spring added, seems like they are unaffected and a family member with PDAC has had negative testing. I think they should be eligible.
Are you saying if someone is from an FPC family and they are unaffected and their affected relatives have had negative genetic testing,
Mm-hmm.
that's certainly a scenario where someone is eligible for cohort 1, even if they don't have testing themselves, like you've tested the appropriate person.
Okay.
Okay.
So I think in general, if there's a question when they have someone they're enrolling that does not speak with a genetic counselor or want to have the training, if they want to just send an email, get in touch with the DCC, and we can just kind of clarify it for them with the situation that they have it currently. Okay. Great. So now we're going to talk a little bit about completing CRFs. Okay. So to complete the visit and learn link, PRECEDE link, you need to complete each task associated with that visit. Okay. So to complete the CRF, you want to click on the link on the iTask, this one here. Okay. And then you'll get the CRF will pop up and you'll have the page navigator, which actually will be on the opposite side of the page than what it's showing here. Once you go through and complete every page with all the available data, you'll go to the questionnaire complete button. In the very last question, you'll mark yes, and is the questionnaire complete? Okay, and that is complete with all available information. Because sometimes there might be some information you don't have. We don't want you to hold off marking it as complete. Just go ahead and mark it as complete as long as all available data is entered. Okay, and then once you've clicked that, you'll want to click the continue button, which will take you back to the iTask page, and then you'll notice in the status column for that CRF, it'll change from not started to complete.
And this is an important concept
Yes.
because if you don't hit questionnaire complete, it doesn't register as a completed questionnaire. So
Right.
even though the data are not all there for you to enter, please do complete this. You can always go back when other information comes available. Just because you hit questionnaires complete, it does not lock out your ability to go back and put additional information in when it is complete.
Correct. Okay, which leads us into the next, which is besides completing the visit component, you also need to update the visit scheduling task, okay, which is found on the iTask, and you want to click the visit link. This is a follow-up visit. It may be an enrollment visit, but it's the very first task for each visit. And then you'll get the visiting scheduling pop-up screen. And then you should confirm that you're in the correct visit by confirming that the visit date as well as the visit date range is all correct. If the visits being done is not completed during this open window, then you should need to exit and find the visit window that includes that visit date. Okay. And then you will update the visit type, and you have 3 choices, which is in person, online, or phone. You just want to choose the option that best describes how the visit was completed. So say you did a kind of a hybrid where you spoke with that participant on the phone, and then you also took a look to get some data from their chart. You would want to mark that as a phone visit because that's what the main contact was. Okay. The final selection that needs to be completed in the visit scheduling pop-up is the visit status. Awaiting schedule is the default, and scheduled should be used when you schedule the call. So if you want to go in and prep it for the visit, you can go ahead and mark it as scheduled. And then in order for a visit to be considered complete and removed from your main task page, you must mark it as either missed visit occurred or lost to follow-up. The lost to follow-up should only be used if you are not able to contact that participant at all during the visit window. Okay.
Wait, I have a question there, Melissa.
Yes. Mm-hmm.
You said there's a visit and a visit date range, but
Yes.
if this visit is occurring outside the visit date range, you would choose a different visit date range. Would you then go back and say that that first one was missed?
Yes.
Or the first, okay, you would not
Yeah, so what
lost to follow up.
Yep. Thank you for bringing that up too, John. Yep, I did not have that in here. So yes, so say someone's coming in and they're in here on January 1st, 2024, okay? So it would be after this date range. You would mark this visit as missed and then go into, since this is annual 1 follow-up, you would want to go into annual follow-up number 2. And then that date would be in that date range. Because the windows are consecutive, so the visit needs to fall within whatever this visit date range is.
And what happens if you put a wrong visit date in that is outside the date range?
You will get queried.
Okay.
Most likely that's what you're going to get queried because it doesn't match. So yeah, and you will actually get a error message, but it's more of a caution message saying, hey, this date doesn't match, but you can still save it. But yeah, you would expect to get queried.
Thanks.
And again, that's another thing. If you have somebody and like they just missed the cutoff, you can always reach out again to the SDCC and we can let you know, like, if you expect to see them again in like say 6 months. So you still have like an annual visit instead of missing that one. A lot of those things need to be done on a case by case basis. So always feel free to reach out to us if you have any questions. Okay.
Looks like, sorry, this is Ben from OHSU. Can I
Yeah.
return to the follow-up CRF on the page navigator C regarding pancreatic cancer history?
Uh-huh.
So on that one, the initial field question is asking if they've had any PDAC diagnosed, and if that is no, the remaining subsequent fields are left open. Um, we can just leave all those as empty and blank and still mark yes as questionnaire complete at the end, or would you like us to mark unknown for a lot of the subsequent fields that have that option?
I'd have to look at the questionnaire to see what it's, are the question, because off the top of my head, is it the following questions have to do with that diagnosis, or are they other questions?
Yeah, they're asking for various stages.
Okay. Yeah, if you mark no, it should actually gray it out if it's pertaining, if you don't need to answer them.
All right. Can we look into that then? Mine are still highlighted.
So are mine. It does it too. You're not the only one. In fact, it's not the only section that does that. I have it on a couple sections that even if you mark no, the following things that should be grayed out don't gray out. I have it on.
Yeah.
Can I send you?
So the more feedback we can get like that, the better.
Okay.
We are always making updates to the system as time goes on, and you guys as the users are the ones who are in it every day. So if you can provide us that feedback to the PRECEDE DCC in an email, we'll get that into the next release.
Sure, I'll do that. Thanks, Melissa. Thanks, John.
Yeah, thanks. No, yeah, and just, if you can provide me with the CRF name and then the section and the question number, yeah, that would be great.
Definitely. Thank you.
Mm-hmm. And we are looking at putting unknown or not applicable or not done, more of those options in for the questions that are relevant for that. So.
Yeah, and that all comes from feedback from out in the field from other coordinators. So the more feedback you can give us, the better.
Right. Yep. And we do appreciate it very much, because you guys are the ones that are using these forms. We can sit and design them and put it in the way we think it goes, but you're the one actually using it in practice. So definitely let us know any feedback that you have. Yep. Okay, so back. Okay, so then again, once again, when you hit save, it'll take you back to the iTask page. And now the visit will show as occurred. And since you have all components of the visit completed, you will now have the event complete check mark will be done. Okay, and that's automatically done in Link. So that's how you'll know, like, oh, yep, this visit's all done. Okay. So do you have any questions regarding completing visits? And as John said, it's very important that we want you to get credit for everything that you do. And so it's very important that you mark the CRFs as completed so we know that you've done them with all available data, as well as completing the visit so we know that it's occurred. Okay. So next we're going to just talk real quick about biosamples, and this is more for just the ordering of the biosamples. So as a reminder, the labels are site specific, so you cannot share your labels with any other site, okay? And they are also very visit specific, so you cannot use the labels for more than one visit. And when I say visit specific, it's one full set goes with one participant for one visit, okay? So if you have extra, don't save them. We do suggest that you discard them, or even better, you can take one and attach it to a document from that visit. So if you have like a source document where you list like what biosamples were collected and processed, you can actually just stick a label.
I do have a question here. I emailed about this, but I didn't quite get the clarification that I thought I needed. If patients are having several follow-up visits, do we need to request labels for each of those follow-up visits?
Yes, there you should have one set of labels for each visit for each participant. So if you have, say, a participant who's going to be doing like the whole 10 years, you would want 10 sets of labels, one for each year for them, for each of their visits. If you
Because
have,
I've done several follow-ups without the labels, so that might be a problem. Okay, darn it.
did you collect the biosamples?
I did, but I didn't get clarification if I needed brand new labels for every visit, so, oh boy.
Okay. Let's talk about that offline. Okay. Sorry that you didn't get the clarification that you were looking for. We can, as long as you have the biosamples and you know which ones were collected when, we can get you the labels to put on them. That's not an issue, but we can talk about it online and see what we can do to get that resolved for you. Okay.
Okay, because I already have several patients this week who are getting their follow-ups. So that's kind of the reason why it's an issue, but nothing I can do about it now.
Do you have labels?
I have labels for initial visits, not for any follow-up visits.
Oh, they're the same labels.
Yeah, it doesn't matter. As long as you have enough labels, they don't have to be specific to a follow-up visit.
Yeah,
You
we
just
don't
have
have
to
separate
use,
ones for initial or for follow-up. They're all just one set of labels.
Okay, but then what do I label the actual ID? Because if it's like patient ID barcode 0001 dash, if the initial is like 01, am I using that same ID for every single patient, or like
Oh, no,
02 or 03?
No. And actually, let me get into Link and I can show you guys an example. So what you're doing to link the participant to a barcode, you're actually doing that by putting the barcode into Link. Okay.
Right.
So let me. Okay, I'm just going to go down to the test facility here. Okay. So when you have someone come in, okay, so you have the biosample CRF, and this one's already completed, but I can show you there. Okay. So when you go in to enter the samples on this last page, okay, you scan the barcode in, okay, and then you populate the material grid, and it shows up, and then you go and mark which ones you collected, which ones were discarded. Okay, so you don't have to put the study ID on the label, because as long as you have the labels in Link correctly, you can just look at the barcode to know which participant it belongs to. Does that make
Kind of, but I'll just have to figure it out on my end, because
Yeah.
something that I'm noticing is that the instructions that I'm required to do on my end and what is required by you are just not reconciling with each other, which is causing a lot of confusion on my end, but I'll just have to figure that out.
Okay, what we can do, okay, is we can set up a call with you and we can do a screen share like this where you can share your screen and we can just walk you through it, okay, and get it figured out for you. Yeah, and I'm happy to do that with anybody. If you are having issues with anything, let me know. I will set up a call with you. Sometimes I find it a little bit easier to do a one-on-one with you to try to figure out your site-specific issue. Okay.
Okay.
Yeah. Yeah. Just send me like an email. Just let me know like when you're available.
Right.
Okay.
Thank you.
We'll do that. Okay.
and Ariel had a follow-up question there, Melissa, in the chat.
Thank you.
And
Just
I
to
think
clarify, if we
the
bank only, I'm sorry.
I think the response is yes, we discard
Okay.
all the unused labels for that person, that 100.
Yes. Yes, we do want to do that. Now, the exception to that is if you have like a document. Like a lot of times what a lot of sites do that I deal with other studies is where you put in the labels into links, they'll actually like print that out to keep for their records so they can actually take it to the lab to mark like which samples were collected and such. And then take an extra label, instead of discarding it, just stick it to that paper. And where that comes in handy is if for some reason you're like trying to put a label in and it's like telling you it's been used before, you can actually take and search for it, find it. And if it says like, oh, we used it for this participant, then you can go back to that label that's on that page and say, oh, we have that label wrong, or yep, somehow we had duplicate labels. It's just like an extra security on confirming what label set you used. Okay, for some reason, yeah, but that's the only reason why you would need to keep them. Besides that, you can discard them because you wouldn't use them for another visit. Link will only allow a barcode to be used for one visit. Okay. So the blood labels come in 17 labels to one set, and then the saliva labels are one label per one set. So when you're ordering them, we always suggest that you order one per participant per visit. And it's up to you how many you want to order at once. Like if you want to just order enough labels to get you through like 6 months, or if you want to do it for a year at a time. I wouldn't suggest more than that. It's a long time to have to keep track of those little labels, but we will probably send out a request quarterly just to remind everybody like, hey, we need your label orders. Thank you for everyone that got theirs in. Again, we probably won't be printing again until January. But if you do need anything before then, let us know and we'll see if we can make some type of arrangements to get those done. Okay. Okay. PRECEDE link releases. So from time to time, we do releases in link and just give update. You know, we update like the questions, skip logic, or put in a new process. And we will let you know when those happen. So the next one's scheduled for October 18th. We do release notes, and we do provide those to the sites, usually the day of the release, and we also post them to the study website. Before the release happens, they will put a little red banner up on the sign-in page that says that link will be down at a certain date and time. So you are aware that it's happening. And then components of the release will be reviewed on a coordinator call, either right before or right after the release, just depending on when the release falls. So the next release will actually fall on a coordinator call, the next one. So we will review what changes are being made to link for that release. Okay. Coordinator newsletter. So we are going to be starting a coordinator newsletter. The first edition is coming in October, but we do need some input from you. We want to know, like, what do you want to see in this newsletter? So far, we've got like putting tips on recruitment, completing visits, PRECEDE link. We would really like to highlight some successes in the study at sites and things like that. But what do you want to see? We want to know what's going to be helpful for you to read in this newsletter. Okay. Another important decision is, what are we going to name this newsletter? I mean, we can just leave it as coordinator newsletter, but if you guys have a really great idea, suggestion for the name, let us know. Because we want this to be very beneficial to you. We want it to be you to feel like you're part of it. So just provide us any suggestions that you have. Okay. So we will be, if you have any suggestions, please get them to us by October 1st so we can incorporate it into the newsletter. And then we will be showing the newsletter on the October calls and then releasing it to everyone afterwards. Okay. We do have a question here. Are pamphlets being used by other sites? We never received ours in Toronto. You didn't receive your site pamphlet?
No, I tried following up a couple times. I never heard anything back.
That's my bad. Can you just email me directly and I will get you your pamphlet? Do we have your PI's photo and
Yeah,
all
I
of their
sent everything. Yep.
Okay.
I'll email you. Yeah.
I'm going to look to say I may have already made it. But go ahead and
Yeah,
email me.
I'd emailed a couple times a few months ago just to follow up, and then just didn't hear anything back. And
Oh,
but
sorry about that.
that's okay. I'll email you anyway after.
Okay.
Thank you.
Yeah,
Thank
because
you.
that'll need to go through your REB since it's patient facing.
Right.
So yeah, we'll definitely need to get that in there.
Thank you.
And if our PI has changed, do we email you for the change of the pamphlet for those? And then have them go back through okay, I'll email you, John.
Yeah. Yeah, anytime you have changes to the pamphlet, yeah, just let us know and we'll work with you on getting those updated and getting it either through IRB, SIRB, or your REB. So, yep.
Yeah, I've got your pamphlet right here, Iolette, with Steve in it. You, Spring, and Steve are the contacts. So
Yeah.
it's all right here. I'll PDF
Okay.
it and send it to you right now.
Okay. Thank you.
Uh-huh.
Okay, so Benjamin has a question about our site has not been collecting labels 11 to 17 up to this point. How should the extra samples be processed? So the samples that are listed as extra, or the labels listed as extra, those are, say something happens to the other labels in that set. You know, like one, it just can't get it to scan, or it gets ripped by mistake, or put on the wrong tube. You just use those extra sample labels to replace it. So, yeah. Okay. So we do have a couple of reminders. The monthly coordinator calls will be held every month on the third Tuesday at 2 o'clock Eastern time, and at on the third Wednesday at 10 a.m. Eastern time. You're welcome again to join one or both calls. We're going through the same topics and agenda on both calls each month. So like I said, you can do one or both. And then if you have any topics you would like covered, please email us at the dcc@arborresearch.org email. Again, these calls are for you. You know, we're going to let you know like anything new that's happening, or if there's like been a lot of questions about the same thing, we'll cover it on these calls. So if there's anything you want to see, let us know. Okay. And then when you're contacting the coordinator, the data coordinating center, always include PRECEDE@arborresearch.org on all the emails, especially if they consider like PRECEDE link questions, protocol questions, regulatory, label orders, or just any questions, comments, or feedback that you have. This email includes several of us on it, so your email will be sent to the appropriate person. Also, if the person you're specifically wanting to email is not in the office that day, you'll still get an answer, okay? You won't be left hanging. Okay. Well, that is everything that I had on the list today, agenda. Is there any questions that anyone else has about anything we've covered today or anything else regarding PRECEDE?
Yeah, this is Shannon. I just wanted to speak up quickly. I got a question forwarded to me from Jessica. So one of the two of us will be on each of these calls as a genetic counselor from NYU. Just to be clear about the question that was asked earlier, if you have an unaffected person who comes in and someone in their family, an affected person, an informative person, has had negative genetic testing and the family meets FPC criteria, that is a completely fine person to enroll in PRECEDE. That unaffected person typically doesn't require a genetic test themselves unless there's something going on in their family, maybe on the other side, that you would want to test them for. But that is fine and straightforward, just like Spring brought up in her comment. If you have, and I think this would be an unusual scenario, if you have some scenario where someone comes in, no one in their family has had testing at all to try and clarify what's going on, and they themselves refuse to have genetic testing, and you can't clarify whether or not it's an FPC family or if it's due to a mutation, that's unusual. I think that person could be in PRECEDE, but it would be strange, and you wouldn't know if they were truly FPC or not. So I just wanted to clarify that those are distinct scenarios. I think people can be enrolled in PRECEDE no matter what, but we want as much information as possible to know that we're correctly sorting them into cohort 1. Does that make sense?
It makes sense to me, but does it make sense to everyone at the sites?
Okay.
All right, well, thanks, Shannon. And I do appreciate you being here today to help with these questions.
Oh, sure.
Melissa, I just had a follow-up to our call just about the CRFs, that they're not updated on the PRECEDE study website, the latest version. I don't know if you've figured out who adds them to the study website.
No, I have not figured that out yet.
Okay.
Thank you. But yes, we will.
Okay, thanks.
So thank you for reminding me. I do have that on my list. I need to move it up on my list.
No problem.
Yes, and again, you guys, please make sure you email the PRECEDE DCC email whenever you email us. I know for myself sometimes, if you email me directly, if I don't respond to you right away, it may get lost in my email sometimes. And I think this is just a general rule. Whenever you email us, even the DCC address, if you don't hear from us within 24 hours, you can go ahead and just give us a nudge again. It's not that we're ignoring you. It's just that with the amount of emails we get, sometimes we might think somebody else is taking care of it or we overlooked it. So definitely give us a nudge after 24 hours.
Hi, Melissa. I have one final question for my site. How do we know if our site is participating in the cfDNA biomarker studies? I'm just looking at the plasma of cfDNA in the manual of operations, and it's optional but required for certain sites.
Yeah, John.
Yeah, that's, can you guys hear me?
Yes.
Yes.
Okay, so that's optional to your site. If you have the capacity to do that extra step and save that biosample, then you're participating. If you don't have the capacity, you do not have to participate.
Thank you.
Yeah, and I would suggest that you speak with your PI to decide if you have that capacity. And yeah. Okay. All right, some more questions? We still have about a little over 10 minutes.
Oh, John, does that also apply for the purified lymphocytes?
Yes, it does.
Okay, thank you.
Well, we do appreciate everyone coming on the call today. And we look forward to speaking with you each month at the coordinator calls. Again, we are recording, so if you have to miss a call, because we know it happens, we'll have the recordings up on the study website, so you can always access it that way and still find out what happened at the call. Okay.
I'll get that to you within the hour. I'm having some funky stuff go on with my computer right now, but I promise you I'm getting you the pamphlet. And same to you, Ariel.
Thank you.
Okay.
Okay. All right. Well, thank you, everyone, and you have a wonderful day.
Thanks, everybody.
Bye.